Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for joining us for another segment. In this segment, we're going to have a conversation with Brook West, Chief Commercial Officer at Carrum Health. She's joining us to discuss why telehealth isn't enough to save providers, health plans, and employers from a backlog of 1 million MSK surgeries delayed due to COVID-19, and how to effectively implement surgical appropriateness through value-based centers of excellence as part of the solution. Welcome to Health Professional Radio, Brook West.
Thank you so much, Neil. It's great to be here.
A bit of your professional background, if you would. Talk briefly about your role as Chief Commercial Officer there at Carrum Health, and then let's talk about why telehealth isn't enough to save money for stakeholders.
Absolutely, Neil. So, yes, my name is Brook West, and I'm Chief Commercial Officer for Carrum Health. I am a career sales and marketer, have been doing it for over 25 years, and since I was 6 years old, if I'm being honest.
Okay.
It was in the last 8 years that I've gotten into healthcare. And once you get into healthcare and start really understanding what the problems are, it's hard to not want to be a part of the solution. So I'm thrilled to be here. At Carrum, I manage really all sales and marketing efforts, so really all of our growth. It's an honor and a pleasure to be a part of Carrum and to be here today with you, Neil.
Great. A backlog of 1 million or more MSK or musculoskeletal surgeries that have been delayed due to COVID-19. That's just one of the things that the pandemic has wreaked havoc on. People not getting surgeries that they need, not getting checkups, not taking their meds, all sorts of things. What do you see as solving the cost problem of this backlog?
Yeah, well, it is a problem. There's no question. And employers have been bracing themselves for, the delayed claims that are now starting to hit their desks. There's no question about it. And so to, get organized to implement a value-based surgical care solution is an enormous lever to not only drive down costs significantly, but to also deliver a phenomenal user experience, an overall surgical care experience to their members where there is high quality, in fact, the best quality in the country at very, very low cost.
Will these steps also identify, hopefully before they're carried out, unnecessary surgeries? I mean, 1 in 4 of these MSK surgeries, I do understand, is not even needed.
Yeah, that's right. The data on unnecessary surgeries in this country and globally is really, really wild. And it needs to be addressed. And that's a huge part of really the Carrum vehicle is to be able to, number one, have, the most rigorous quality evaluation methodology to be able to identify, the top 10% of surgeons in the country who, through data and evidence, years of data and evidence, this is a group of surgeons who, it's been proven that if left to their own devices, they are going to deliver the most appropriate care, meaning if you need surgery, Neil, they're going to send you to surgery. And if you don't need surgery, they are going to, prescribe a less invasive, more conservative approach. So you've got to start there, work with the surgeons who are going to do the right thing. The second thing is you've got to put a vehicle in place to, so you're not leaving the surgeons to their own devices. You're putting a vehicle in place to create backstops to ensure that the most appropriate care is going to happen. And so that you can avoid these unnecessary surgeries. And the way you do that is really through aligned incentives. So you put, economics in place such that surgeons are going to get paid, whether they send a patient, to a surgical path or not. So you kind of start there. So now they are truly incented to do the right thing. However, on the back end, should a surgeon recommend a patient, go through with surgery, we require that every single surgeon commits to a minimum of a 30-day warranty for complications in readmissions. So now if a complication happens, that surgeon is now at risk. They are essentially, absorbing the cost of, for any kind of readmission or complication. So if you think about that, now there's mechanisms in place where a surgeon who probably already is going to, prescribe the right treatment for a patient. Now they're going to think twice, 3 times, 4 times about what is the right thing to do here, because the incentives are now completely aligned with what is the best possible treatment path, care path for the patient.
What do you say to those who are of the mindset that telehealth is going to be the cure-all based on, of course, the pandemic, based on people's fears of actually, that hands-on relationship with their caregivers like it used to be? What do you say to those who say that telehealth is the cure-all to be able to offset some of the costs by, cutting down on the transportation, the wasted time, the lack of efficiency with those in-person visits?
Yeah. Well, I'm a believer in telehealth. I think telehealth is an unbelievable tool, unbelievable to have an access point such as telehealth, especially in a pandemic. And it will help as it relates to, some of the initial screening, some of the initial visits. But it's really not going to help, with something like an MRI or something like a knee replacement. Maybe someday, Neil, maybe you and I will still be around, when this happens, that there will be some sort of technology where we can do a knee replacement, spinal fusion, and, a bariatric procedure, through telehealth. Today, I don't believe it's possible. So it will help on the front end, but at the end of the day, these procedures still need to be in person. And so I think it's definitely a step in the right direction, but ultimately, you need to have other mechanisms and tools in place, such as the ones I mentioned previously, to really be able to, deliver, a value-based care surgical episode that is going to balance reducing costs significantly, delivering the highest possible quality, and therefore outcomes and experience for the patient. So I think it's a step in the right direction. I believe in it, but ultimately you're going to need more to solve the problem of, the million or so delayed musculoskeletal surgeries.
If I'm understanding correctly, you were talking about incentivizing those surgeons to do the right thing, as you said. What are your thoughts on bundled payments as part of doing the right thing and, as you said, still getting paid? Absolutely.
This is part of the deal. So, we've all been to the doctor for a regular visit or a procedure where we get, bill after bill after bill in the mail, and we're just completely confused as to why that's happening. And sometimes it's, out-of-network doctors that were part of a procedure. We didn't even know that was going on. That whole environment, is being changed through bundled payments. So this is where, a company like Carrum, we're going directly to the provider and negotiating rates and bundled payments where every single step in the episode of care gets bundled into a single payment. So now the surgeon, in the provider organization is aligned with, eking out any kind of inefficiencies and really focusing on delivering, the high value quality of care. So I'm a huge believer in bundled payments. I mean, that is, Carrum is a Centers of Excellence and Bundled Payments platform. So we believe that it's this business innovation, how care is paid for and delivered that is going to completely change this market. I mean, it's really the moral equivalent of the difference between, a Blockbuster and a Netflix. I mean, let's all embarrass ourselves a little bit, Neil, and admit to how much content we consume on streaming services such as Netflix, Hulu, Amazon Prime, HBO Max. I mean, the list goes on. And imagine if we had to pay, $5 for every episode we watched. Let's just be honest, Yeah. We'd start reading books or something.
Absolutely.
But, that's really the difference, in what Carrum is providing with bundled payments. We're bundling the episodes of care to optimize for quality and to eke out inefficiencies in the economics of delivering the care.
Give us a website where we can learn more about Carrum Health and the services that you're offering there.
Yes, absolutely. Our website is www.carrumhealth.com.
And that's spelled CARRUMHEALTH.com, correct?
That's correct, Neil. Thank you for spelling it out.
Brooke, I appreciate you lending us some of your time this evening here on Health Professional Radio. It's been a pleasure speaking with you. Thank you so much.
Likewise. Thanks so much, Neil.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Brook West, Chief Commercial Officer at Carrum Health. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download at SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com, Health Professional Radio.